and I don't think I want to call it Black Girls Code, but I'm not positive it's going to fly. And she was like, are you kidding me? Absolutely. Now, this is still a mentor and an icon for me, so to speak. And she's the founder of Women's Sphere, and she's from the Philippines. And she was like, no, I am a Black girl. I get this. Like, you go name. She literally made me go and get the name on the web to see if it was used yet, and did it like right on the spot. Like, she's like, you do the rest when you get home. And I think for that was my first affirmation that it was okay to be unapologetic about this community that we wanted to serve, because really Black Girls Code is a term of affirmation as opposed to segregation. It's not saying that other girls and women can't come into our space, because they do. Even in Johannesburg, those classes are diverse. They're not just Black South Africans. It's about making sure that these girls know it's okay to be their full selves, because that was my reality. I was not just an engineer. I was not just a woman engineer throughout the 20 plus years of my life. I was a Black woman in a male-dominated technical field. And I could not take that identity off, but I needed this next generation to know it was okay to bring their full self to the table. So the work that we do is with Black and brown, Black, Hispanic. Sometimes that means girls that are from the Philippines, or sometimes that means girls in the Bay Area that are Pacific Islander are in those classrooms. Sometimes that means Caucasian girls are in that classrooms. Anyone is welcome. But this term and this organizational, the face of the organization is meant to say it's okay to be who you are, and we're going to focus on this demographic because we're the least represented in this industry.
All right. I think we've got time for a couple of questions. Right here.
Thank you. Amazing organization. Can you tell everybody here how the different groups here can help you, from corporate to government to
That saves
individuals?
me my last question.
That's a great question. Thank you. So one of the things that, as Dan and I were talking on, we have lots of corporate partners that work with us. I'm back and forth. I live in the Bay Area. But when I was talking to a partner yesterday, they asked me, what does success look like? And I was like, that's a great question. It's about thought partnership. So we're looking to partner with corporate partners that not only want to just write a check, although checks, I'm in nonprofit, they're always great. They're always great. But I want someone to build with. I want someone to say, hey, this is what we do within Black Girls Code. Come work with us and let's figure out how we can make a ripple in the industry, because we can't change it all. But we know if we work with your company, we can make a ripple. And I think that ripple creates other ripples. So we're always looking for corporate partners, for folks that are in government. As we expand past the 15 cities that we're in, we're looking to partner with school districts. We're looking to partner with cities and governments on policies that make CS available for student learners. For folks that are building companies, we certainly are looking to partner with you all in terms of feeding that pipeline as you build and giving internship and mentorship opportunities to students. So working in, I would say, collaboration with anyone in the room that is doing work to really change this industry are what we want to do. Yes.
We have one more quick one.
Hi, I'm Mary Jane Salvato. I'm the founder of WebFlutter.
Hi.
About to launch, and I'm an engineer as well, and I've been involved with nonprofits. I wanted to know if you could tell the audience, in your experience, is there any skill sets or personality traits that you've discovered in girls that make them a success in what you're doing?
Absolutely. Collaboration. Collaboration is something that I have found with our girls, and not wanting to work in isolation that makes them very successful in the projects that they create. So being able to come to the table not with just the idea as well as the solution, but looking to build upon those skill sets of their other teammates is something that we built in Black Girls Code from the beginning. It's very rare that they're doing a project alone. It's very rare. I can only think of maybe Maybe on web, when they're doing web design, maybe they are working along, but most of the time it's all team-based. And those are the skills that we see them thrive in by pulling in the different skill sets of those around them. And I think that is what's going to be a game changer as they come into the industry, that having those heavy collaboration skills and being able to lift all those boats as they rise.
All right, ladies and gentlemen, Kimberly Bryant.
Yeah. All right, thanks, Dan.
So much.
You're very welcome.
Thank you, Kimberly.
You're welcome.
I love that collaboration for responsible growth keeps coming up organically. So we're getting one more chair, and then we're going to get our next session. Come on, guys. So this next session also is very much focused on collaboration for responsible growth, both on the collaboration and the responsibility side. So maybe you should move your chair slightly up, Rob. Thank you, so I can see you. Rob Stevens, on my left and your right, is a general manager at Philips, and he is very involved in a partnership that Philips has with Charles Redding's organization, MedShare, which he is the CEO of after having spent many years at Johnson & Johnson in logistics and other stuff in senior roles. And MedShare, well, I have this statistic right here, has delivered over $220 million in medical aid to communities in 103 countries, and is partnering with Philips with their state-of-the-art biomedical equipment in order to improve biomedical service offerings in underserved communities around the world, and really just taking a very big picture view of how we can responsibly assist people in the world who have less, but also be more sustainable in the use of what we've got here, because otherwise a lot of it would get thrown out. I mean, Charles, talk a little bit about how to think about it. Am I saying it right?
No, I mean, you are. I mean, the core principle of our mission is to take things that normally would end up perhaps in landfill just because they've outlived their usefulness here in the U.S., and at the same time repurpose these things to save lives. And so if you think about it, particularly in the developing countries, sub-Saharan Africa, upwards of 70% of the equipment is unused, unoperable. And it's typically because either they don't have the instruction manuals, they don't know how to use it, and partnerships like we have would bring a sustainability factor to these communities that can repair this equipment and ensure that it's continuing to deliver healthy outcomes for the patients.
And you partner, I know, with many, many companies. Philips, though, I think is one of your biggest partners. I bet maybe, Rob, you should just quickly describe what Philips does, because it's changed in recent years a little bit. It's, you know, really honed in on the medical. Explain that, and then talk about how you think about the partnering with MedShare.
Sure. So maybe many of you recognize Philips as a television or a light bulb company, but really we've transformed the organization into a pure health technology where we're focused on a continuum of healthcare, starting with prevention, and then when you go into a hospital or healthcare facility, but then also living with chronic disease or taking better care of yourself at home. And that's really the mission of Philips, is to improve the lives of 3 billion people by the year 2030.
Yeah, that's a target you have, right? I mean, but in terms of technology, you're very big in certain technology areas. Just talk about what some of them are.
So MRI, CT, monitoring, in terms of biomedical equipment, but also extending beyond that with healthy living such as Sonicare toothbrush, but also our mother and child through the Advent baby products as well. And then a full line of monitoring fetal equipment, incubators as well.
So give some examples of the kinds of things that you would be able to provide to MedShare, and then maybe Charles can talk about what MedShare does with that.
Mm-hmm. Sure. So we donate, as an example, ultrasound, fetal monitors, and then of course, as I mentioned before, the Advent baby care product line, and that's really in support of MedShare's Mother and Child Wellness Program. But for Philips, and for me, what makes this relationship unique and one that works so well is that we just don't donate the equipment. My team is providing all the manuals, service manuals, operation manuals, service training, as well as clinical application. So we're ensuring that that product is going to meet its intended purpose and continue to live another useful life once it leaves the United States.
And just one more thing, Philips, you know, unlike a lot of American companies, which Philips is American, but it's headquartered in the Netherlands,
Yeah.
you really talk about the circular economy, which is something that I think we need to talk more about. Well, how, you know, because what would happen to this stuff otherwise, a lot of it? And where do you get it, just quickly?
Yeah, so where we get most of it is either through our demo fleet, as well as the majority comes in through traded-in equipment. So, you know, a customer in the United States has bought a new piece of equipment, and it comes back to our Nashville services facility, and that's both Philips and non-Philips equipment. And just to give a statistic, last year we recovered more than 2 million pounds from the returned equipment, either the steel, breaking it down to its raw material, steel, copper, etc. For a subset of the products that we ensure are fully functional, we have all the information, all the documentation. That's where it enters the pipeline into the MedShare organization for, again, a second life, if you will.
Yeah, so Charles, where would it go, for example?
Yeah, I mean, one of the programs you mentioned was our maternal child health program, and the ultrasounds are literally a godsend for us. Probably the best way really is just share a story. Particularly, most of the countries we're working with many times have no ultrasounds, let alone 1 or 2 or 3. So even if they have one, if we provide them with another, we've increased their capacity, we've doubled their capacity. But we had a situation recently in Nicaragua where we delivered an ultrasound to where a mother was actually in distress. And using the ultrasound, they were able to determine that the baby was in distress is the reason it was causing distress for the mother. She was very low on the amniotic fluid. They conducted emergency C-section and saved both the mother and the child. And so without equipment like this, they just can't do the diagnosis they need to improve the outcomes for the patients. We hear these stories all the time. Most of our work, we try to help them make progress toward the sustainability development goal, particularly in the way of good health. And the way we go about doing it is really just to help them improve the quality of their health system, to improve access to quality health care. And it's through partnerships where we can bring in this cutting-edge technology to really lift the results of that entire community is where I have hope that we can improve the state of the world.
One thing I didn't ask you about when we talked on the phone was how much global experience you had before doing this. But, you know, as an American, we complain about our healthcare system.
Sure.
But we got an awful lot going on compared to, I mean, how shocked have you been as you've begun to travel around the world more methodically to some of these countries that really have so little, and just talk a little bit about your feelings about that.
Yeah, one of the first questions I often get is, why are you guys focused so much outside the U.S.? And although we do provide services inside the U.S. as well to the underinsured and uninsured, the best way to describe it to anyone that asks me that question is simple. On a worst day here in the U.S., you have an option of going into a hospital, right? In many of the countries that we work with, there is no hospital to go into. Or if there is one, maybe it's 50, 60 miles away. Many of these countries, the only source of health care is through what we call primary care. And that could be through a health post, some community-based service, very low tech. And so most of our products and services, we focus not just on the high-tech solutions, but also on those very low-tech. Something as simple as a clean birthing kit for a mother that's going to give baby outside of the medical institution could mean life-saving, both for the mother and the child. And this is just very something to, to cover the ground and make sure they're using clean items to reduce the infections, to make sure you can have a healthy baby. So it's really no comparison. I'd be the first to admit that we've got issues here that we need to continue to work on. But as I've traveled around the globe, I've just been, my heart hurts when I see some of the conditions and knowing that we are throwing things away here that can literally save lives there. And that's why I'm so passionate about the work we do.
Well, and it is true, the Sustainable Development Goals are uncompromising in what we're trying to achieve as a planet by 2030, which is really give healthcare services to everyone.
Yes.
No poverty is one of the goals. That is not a joke. That's a hard thing to achieve, but it's a reasonable target to have. But I wonder whether either one of you can talk about, having worked together, maybe you've gotten some thoughts about other ways that we can move in comparable partnering directions. Or obviously this is a very powerful program, but it's relatively small compared to the scope of need and probably the scope of opportunity. I mean, any thoughts from either one of you on that?
Yeah, no, I'm a true believer in these public-private partnerships. It's really, and most of the work is really, the public partnering with private institutions and the governments. And part of the work has to be focused on helping them help themselves. So not going in with a perceived solution, but understanding what the challenge is and then bringing, people with various resources together. So I just think that's a scalable model. Most of the issues you find in the world, if there's a collaborative effort, in fact, we've even changed a lot of our impact metrics around collaborative impact, as opposed to assuming you can do it alone. If we want to make true progress and do it in a very rapid pace, the only way to do it is to collaborate, and which is why I'm so thankful of the partnerships I have with Philips and other large healthcare companies like that.
Any thoughts? I mean, other things you are doing or could do or want to do?
Well, there's a lot of things that we want to do and that we could do, and Charles and I were talking about those this morning before we stepped in here. But I think I just want to reiterate one point, which is you have to help the local organizations be able to sustain themselves.
Right.
And that's why Philips is taking the approach not just to donate the equipment, but to ensure that through our partnership with MedShare and the train-the-trainer model, that the local teams in the local countries know how to service the product, know how to use the product to its full capability. Because if it was just here's the machine, it's a sub-optimized proposition.
Yeah, it's not just about us feeling good about giving something away. It's about making sure it really makes a difference.
That's right.
That's right.
What were you talking about that you could do that you haven't done yet?
Yeah, I mean, I'm always thinking up these ideas, but one of the things we want to do, we understand the importance of biomed training and repair, and we have one engineer that literally spends the bulk of his time going to these different countries, doing pre-assessments, bringing and calling in 30, 35 technicians, end users, electricians, just to train them how to properly repair and giving them the tools. And one of the things that we were just talking about, why not open that up to others? There's a lot of trained biomed professionals here. So we like to start, these biomed mission trips where we put a call out to go to a particular country, a particular hospital, and we come travel with us.
Right,
and we maximize our impact.
We didn't talk about the volunteerism where Philips is putting a lot of people hours into this too. Talk about that a little bit.
So I'm also a volunteer at MedShare as well. And so I've got to firsthand experience in their unique process. So in the warehouse, taking pallets of surplus materials that have been donated from hospitals, and through an innovative process, collect, categorize, organize, repackage, so that those goods could then be put into MedShare's warehouse and inventory, so that those goods can serve people and save lives.
And the company encourages, I know there's a huge amount of volunteerism that Philips, do you have the figure how many hours or how many people? It's a lot of people.
We've been partnering and volunteering with MedShare for over 7 years. Mm-hmm. And so it's measured in thousands of hours.
Well, actually, and you have these, how many giant warehouses?
Well, we've got 3, and we use 20,000 volunteers a year.
Wow.
So it's
these warehouses are packed, because it's not just, ultrasound and CT scans. Right. It's also, gowns and bandages. And
that's correct.
All kinds
of dressing,
amazing.
Sutures, shoe covers.
Well, I hope it grows even bigger. I hope more companies are inspired to do something similar. And thank you both for coming here to explain.
Thank you.
Thank you very much.
Thank you very much.
So much, Paul.
Thank you.
Okay, go up this way here. We're going to have Dan Costa back with somebody who I've known for many years, Martin Mikos of HackerOne. Come on up, guys. Martin is a longtime great open source visionary and executive who's now bringing that mindset to security. So thanks so much for being here.
Thanks, thank you.
Thanks, Dan.
Yep. All right. Martin, thanks for coming today. Maybe the place to start is, I think maybe this is a fairly technical audience, but let's explain what bug bounties are, how they work, and how much money can be made on a single bounty.
Yes. Well, let's start from the bad news. Nobody wants to get hacked, and everybody gets hacked. Every consumer, every company, everybody gets hacked. But now, fortunately, there are people who are fixing it, whether we ask them to or not. We are asking them to do it, but they'll do it anyhow. It's the young generation. They are fixing it for all of us because we are incapable. We bury our heads in the sand. We don't know the crap we have created for the future generations. But they will fix it. And bug bounties is based on the idea that if you have a web app or a mobile application, then if good guys can break in, then probably bad guys can too. And if good guys cannot break in, then probably bad guys can't either. So let's ask the good guys to try to break in. If they break in, you can fix it and all is good. If they cannot break in, all is good. So that's what we do. That's our business. We have today 400,000 freelance hackers, security experts, researchers, whatever you call them, finders, who look for software vulnerabilities in all your websites and mobile apps and report them to the companies. And then when they find something, we pay them a bounty.
So, and it's almost, you've set up HackerOne to be like hacking as a service. So you can see all the vulnerabilities. Your freelance hacker staff can log in, look for things they're good at diagnosing and good at solving, and sort of pick jobs off the company. How do you find those hackers? How do you vet them?
Well, it is hacking as a service, but everybody could do it themselves. You can have a neighborhood watch just with your neighbors. You don't need a company to orchestrate it for you. It's much easier with us, but you could do it yourselves. The wonderful thing is we do not recruit hackers. It's a little bit like NSA or MI6 in the UK. They don't have a